Hello friends, welcome back to Love Medics. This lecture is on Glasgow Coma scale. We can denote it as GCS. GCS is used to describe the conscious level of patient with traumatic brain injury, head injury, trauma patient or unconscious patient. The GCS is divided into three categories, which means we should check the three responses. They are eye-opening response, verbal response and motor response. Before going to check these response, first we should check the patient whether the patient is affected with any paralysis, deaf and dumb, any hearing problem. If they are present, some responses are not applicable for this patient. Now, eye-opening response. The minimum score is 1 and the maximum score is 4. If the patient opened their eye spontaneously, then the score is 4. Or if the patient opened their eye to any speech or any sound, then the score is 3. If the patient opened their eye to pain or any pressure, then the score is 2. If the patient has no response to any stimuli, then the score is 1. Next, verbal response. If you ask the patient, who are you and where are you? If the patient responds with, I am Jack, now I am in hospital. So, he is oriented to time, place and person, right? Then the score is 5. If the patient replied with, I am Jack, I think I am in restaurant. So it is confused conversation. Then the score is 4. If the patient responds with chair, table, like this means, so the person's response is inappropriate. So the score is 3. If the patient replied with it is incomprehensible speech, right? Then the score is 2. If the patient no response to any sound, then the score is 1. Here the minimum score is 1 and the maximum score is 5. Now motor response. Here minimum score is 1 and the maximum score is 6. If the patient obey your command, then the score is 6. If you pinch the patient hand or forearm, the patient correctly localizes the pain but he does not obey your command, then the score is 5. If the patient move their body parts to withdraw from pain, then the score is 4. If the patient lies with abnormal flexion, which means decorticate position, then the score is 3. If the patient lies with abnormal extension position, which means decerebrate, then the score is 2. If the patient no response to anything, then the score is 1. Now you should sum up all the scores of each responses. The minimum score is 3 and the maximum score is 15. If the score is between 13 to 15, then the patient is affected with minor brain injury. The score is 9 to 12, the score is affected with moderate brain injury. Or if the score is 3 to 8, then the patient is affected with severe brain injury. That's all about GCS. Thanks for watching.